Imagine you are with someone who is having a seizure, and you might feel uncertain about the best way to help. It is completely natural to wonder if this situation requires immediate, emergency medical attention. Knowing when to call 911 can make all the difference in providing the right support at the right time. When someone is experiencing a seizure, you should call 911 immediately if the seizure lasts 5 minutes or longer, or if they have multiple seizures without fully recovering in between. These specific instances signal a medical emergency that requires professional intervention to ensure the person's safety and well-being. The primary reason these situations are critical is the potential for significant medical risk. Prolonged seizure activity, known as status epilepticus, can lead to brain damage and other serious health complications if not stopped promptly. Also, repeated seizures without regaining consciousness place considerable strain on the body, increasing the chance of injury or breathing difficulties. To help you confidently decide when to call for emergency help, here are the key scenarios to remember. Always call 911 if the person is injured during the seizure, such as hitting their head or falling from a height. Emergency services are also needed if the seizure occurs in water, like while swimming or bathing, due to the risk of drowning. Call if the individual does not regain consciousness or has trouble breathing after the seizure stops, or if it is their first ever seizure, especially if they do not have a known epilepsy diagnosis. Furthermore, if the person is pregnant or has another chronic medical condition, such as diabetes or heart disease, a seizure can be particularly dangerous, so calling 911 is essential. A useful guideline often recommended by medical professionals is the 5-minute rule. If a seizure continues for 5 minutes, or if it is prolonged beyond what is typical for that individual, it is time to call 911. This threshold helps distinguish a typical seizure from one that may escalate into a more serious condition. Another critical indicator is if the person remains unconscious or seems unresponsive for an unusually long time after the seizure has ended, moving beyond the usual post-seizure recovery period, which is often called the post-ictal phase. By understanding these specific situations that warrant an emergency call, you empower yourself to act decisively and compassionately when it matters most. Your swift action in these moments can help ensure the person receives the necessary medical care quickly, protecting their health and providing reassurance during a challenging time.